I really think that one of the most joyful aspects of being a doctor is the true privilege of getting to know the children, the teenagers, and their family. And that doesn't just happen. It's a shared experience. And so my patients know a lot about me. My name is Dr. Brenda Banwell. I am the director or chair of the Department of Pediatrics at Johns Hopkins Medicine. I am the pediatrician-in-chief and the co-director of the Johns Hopkins Children's Center. I am a pediatric neuroimmune specialist, which means that I look after a relatively rare population of children and teenagers who experience diseases, some chronic, some brief, but often really quite severe, where the immune system is attacking in the brain, the nerves that supply the eyes or the spine, leading to acute deficits or difficulties, perhaps with vision, thinking, movement, perception of sensation, and overall neurological function. Specifically, I look after children with multiple sclerosis, a disease called MOGAD, and many other conditions in which the immune system attacks the nervous system. So I chose pediatrics because I really recognized that I wanted to spend my career looking after children. I think one of the best ways to determine whether a career in pediatrics is for you is whether you can convincingly examine a 2-year-old and whether you can talk to a 15-year-old. Because those two populations of patients are incredibly discerning judges of whether you belong in pediatrics. And one of the most rewarding aspects of medicine is to be able to examine that frightened, apprehensive 2-year-old and have them leave your office smiling and giving you a high five. And learning from a 15-year-old what they care about, which is often very different from what they think they are there to talk to you about, and often dramatically different from what their parents think they brought them in to talk about. But most importantly, it's their lived reality and their issues and the things that they need you to help them with. And pediatrics offers all of those opportunities. First and foremost, patient care begins and is entirely about the child and their family. If we offer the world's best care, we do so in the concept of we are there to serve our families, to work with them, to understand their goals and needs, to work with our children, infants, toddlers, teenagers, to understand not only what they need medically, but how they're coping with that emotionally and psychologically, and then putting that all together to provide a holistic approach to optimize the care we provide to every one of these patients. My research journey began with my patients and has always remained focused around the children that I care for. So my first area of research was to better understand how children with neuroimmune conditions present or show up. What do the conditions look like in terms of the symptoms the child experiences and the findings that the doctor examining them would see. So a lot of my initial work was recognizing the patterns of neuroimmune diagnoses in children and communicating them so that other doctors recognized it as well. We then moved to better understand what these presentations mean in terms of how they're affecting the brain. To do that, a lot of my work has been centered around imaging, or particularly MRI studies, photographs of the brain and spine and optic nerves, so that I can both visualize, I can actually see what the neuroimmune disorder is doing in order to help with the diagnosis, but then also use that as a tool to make sure that the treatments we give are shutting that process off and that the inflammation or attack in the brain, spine, or nerves has now stopped. And what I'm excited to say has been the true highlight of my career is that in today's clinic, not only are children diagnosed correctly because the diagnosis of multiple sclerosis and MOGAD and other similar conditions formally include pediatric patients in the diagnostic criteria so we can give a proper diagnosis clearly and accurately. And the current therapies for these conditions have changed the world of children living with multiple sclerosis. The true joy of doing something for 3 decades is that I also now have photographs of my first patients who are themselves parents. And it is incredibly rewarding to know a patient from their journey from age 4 through to their young adult lives and to see them being successful and happy and living their best lives.